For X-rays to occur, X-ray tube needs to be in a sealed vacuum, a source of electrons, and a way to rapidly decelerate or stop the electrons. An X-ray tube is a device that produces X-rays. An anode disc is where electrons are decelerated in the X-ray tube, and is typically made of tungsten. The anode target, or focal spot, is an area of the anode struck by the electrons from the cathode. The stator consists of induction motor electromagnets that make the rotor turn. The rotor is the rotating member that spins the anode, and is typically made of copper. A cathode serves to expel the electrons from the circuit and focus them in a beam that travels to the focal spot of the anode. The focusing cup is an area on the anode that directs the electrons to the focal spot during X-ray production, and typically composed of nickel. The cathode filament is located in a focusing cup and is made of molybdenum, which has a high melting point. It helps to direct the electrons produced toward the cathode. It is typically made up of tungsten. An exit port, or window, is an exit way for the useful components of an X-ray beam. A glass envelope, or glass vacuum tube, contains the anode and cathode of the X-ray tube and is typically made of heat-resistant Pyrex glass. The primary circuit is a technical factors responsible for controlling the voltage supplied to the X-ray tube. Temperature, pulse, respirations, and blood pressure are vital signs. A normal range for body temperature is 97 to 100 degrees, averaging 98.6 degrees. A normal range for blood pressure is a systolic less than 120 over a diastolic that is less than 80. A normal range for respiration is 12 to 20 breaths per minute. A normal range for pulse is 60 to 100 beats per minute. Homeostasis is the process by which organisms maintain a relatively stable internal environment. The means of measuring temperature are rectal, oral, axillary, tympanic, and temporal. A pulse oximeter is an external monitor placed on the patient's finger or earlobe to measure the oxygen saturation level in the blood, as well as the pulse. A sphygmomanometer is an instrument used along with a stethoscope to measure blood pressure. It's also known as a blood pressure cuff. Hypertension is another term for high blood pressure, BP higher than 140 over 90 mmHg. Hypotension is another term for low blood pressure, BP that is persistently lower than 90 over 60 mmHg. Tachycardia is a rapid heart rate, over 100 beats per minute. Bradycardia is a slow heart rate, less than 60 beats per minute. Tachypnea is an increased breathing rate, higher than 20 breaths per minute. Bradypnea is an abnormally slow rate of respiration, usually of less than 10 breaths per minute. Dyspnea is a condition of difficult or labored breathing. Orthopnea describes an inability to breathe unless a person is in an upright or straight position. Apnea is the cessation of breathing. Practices and procedures that prevent the spread of infection are termed infection control. A disease is an abnormal state in which the body is not functioning normally. The prefixes pathy and patho signify the presence of a disease. Infection is the invasion of body tissues by disease-causing pathogens. Pathogens are disease-causing agents such as bacteria, viruses, fungi, and protozoan parasites. Three attributes of pathogens are that they 1. Multiply in large numbers and cause an obstruction. 2. Cause tissue damage. 3. Secrete organic substances called exotoxins. Bacteria are single-celled organisms that lack a nucleus, prokaryotes. They may exist in colonies. Viruses are tiny particles, smaller than bacteria and other pathogens, which must invade living cells in order to reproduce. When they do invade, the cells are damaged or destroyed in the process of releasing new particles to infect other cells. Pathogenic fungi thrive in damp, humid conditions on the surface of the human body. They can be macroscopic such as yeast and molds. Common symptoms include redness, itching, burning, and blisters. Examples are yeast infections, athlete's foot, and ringworm. Dimorphic fungi are a group of fungi that can exist in two distinct forms, yeast and mold, or filamentous. This ability to switch between morphologies is often triggered by environmental factors, particularly temperature. For example, many dimorphic fungi grow as molds in cooler environments and shift to a yeast form at warmer temperatures, like those found in the human body. Blastomyces dermatitis is primarily a lung infection that can disseminate to the skin, osteoarticular structures, genitourinary tract, and other organs. Chronic skin and bone lesions are the most common extrapulmonary complications. Coccidioides immitis, or Coccidioides posadacei is a New World pathogen. The disease caused by Coccidioides species, coccidioidomycosis, is also known as San Joaquin Valley fever, or simply valley fever. Some patients develop a complicated pneumonia. Disseminated coccidioidomycosis refers to disease outside of the chest, most commonly to sites such as the skin, joints, bones, and meninges. Histoplasma capsulatum. Histoplasmosis in humans is caused by two distinct varieties of H. capsulatum. The majority of human infections are asymptomatic, but acute severe pulmonary infection occurs in either an immunosuppressed host or an immunocompetent host who inhales a large inoculum of H. capsulatum cells. Paracoccidioides brasiliensis is the causative agent of paracoccidioidomycosis. Individual patients can exhibit a range of clinical manifestations ranging from a localized, benign disease to a disseminated, systemic mycosis. Disseminated disease is often fatal unless treated. Beyond the primary pulmonary disease, disseminated disease can also manifest, affecting the reticuloendothelial system, lymph nodes, skin, and mucosa. Sporothrix schenkii is a fungus with worldwide distribution, unlike many other dimorphic pathogens and more akin to the better-known but non-dimorphic Aspergillus fumigatus. It is associated with soil and plants. It is often known as rose grower's disease. The disease is often manifested as a chronic granulomatous infection. Protozoan parasites are unicellular, or single-cell, organisms defined by their movement. They may be flagellates, amoebae, sporozoans, apicomplexans, or ciliates. Protozoa are neither plants nor animals. Common diseases caused by protozoa include malaria, amoebiasis, also known as amoebic dysentery, giardiasis, an intestinal infection, toxoplasmosis, a parasitic infection caused by the parasite Toxoplasma gondii, trichomoniasis, a common sexually transmitted infection caused by a parasite called Trichomonas vaginalis, and leishmaniasis, a parasitic disease transmitted through the bite of infected sand flies. These infections affect various body systems and can lead to symptoms ranging from gastrointestinal issues to severe systemic complications. The two forms of fungi are yeast and mold. Fungal diseases can be classified as superficial, cutaneous, subcutaneous, or systemic. Superficial fungal infections affect hair, skin, nails, and mucous membranes. They can be treated with topical agents. Cutaneous fungal infections, also known as mycoses, are common skin infections caused by fungi that affect the skin, hair, and nails. Subcutaneous fungal infections affect the deeper layers of the skin and, sometimes, even bone. Systemic fungal infections most commonly affect the lungs and central nervous system. These are severe and often opportunistic infections seen in immunocompromised patients. A fomite is a physical object that serves to transmit an infectious agent from person to person. A vector is an organism, generally a blood-feeding arthropod, that transmits infectious diseases. Infectious disease are established in this sequence. 1. Encounter. 2. Entry. 3. Spread. 4. Multiplication. 5. Damage. 6. Outcome. The encounter of a disease involves the infectious organism coming in contact with the host. Entry of disease occurs through angrization or penetration. Spread of disease is the propagation of the infectious organism. Multiplication of disease increases the number of pathogens. Most pathogens must multiply in order to be recognized, or diagnosed. Damage from diseases can either be direct or indirect. A chain of infection includes a host, an infectious microbe, a mode of transmission, and a reservoir. The human body is in a state of dynamic equilibrium with microorganisms. Healthy individuals have a peaceful coexistence with microbes and a lack of diseases. Occasionally, the balance tips in favor of microbes and disease results. Infectious microorganisms are bacteria, viruses, fungi, and protozoa. A mode of transmission is the manner whereby the infectious agent can be transmitted to another reservoir or host where it can live. Transmission modes are either fomite or vector. Reservoirs harbor a disease agent on the landscape for long periods of time. Reservoirs are usually unaffected, or minimally affected, by the agent. Some routes for exogenous or endogenous disease transmission are air, droplets, and contact. Airborne transmission particles are tiny, can stay in the air for a long time, and can travel long distances. You can breathe them in even if you're some distance away from the source of the infectious agent. Respiratory or salivary secretions are expelled from infected individuals through droplet transmission. Droplets are larger than airborne particles and released when a person coughs, sneezes, talks, or even breathes heavily. Direct contact transmission, or person-to-person transmission, occurs when microorganisms are transferred directly from an infected person to another person. Healthcare-associated infection, or hospital-acquired infection, or healthcare-associated infection, or HAI is an infection acquired within a healthcare setting during the delivery of medical care. Nosocomial infection is another term for hospital-acquired infection or healthcare-associated infection. An iatrogenic infection is an infection acquired as a result of medical treatment or care. These infections can arise from medical errors, negligence, hospital-associated infections, HAIs, or other factors during treatment. Blood-borne pathogens are disease-causing organisms transferred through contact with blood or other body fluids. HIV stands for Human Immunodeficiency Virus, the virus that causes AIDS. HPV, Human Papillomavirus, is a virus that can cause genital warts, cervical cancer, or may be asymptomatic. Defense mechanism of the body may be either internal or external. Standard precautions are recommendations that must be followed to prevent transmission of pathogenic organisms by way of blood and body fluids, and include hand washing, proper gloving, PPE or personal protective equipment, needle recapping and disposal, and correct mitigation of biospills. Gloving techniques stipulate procedure for self-gloving and for gloving another person. Examples of personal protective equipment are gloves, masks, safety glasses, and protective clinical attire. Gloves and appropriate PPE must be worn to clean biospills. Methods of infection control include hand washing, hygiene, sanitation, disinfection, and sterilization. Disinfection is a process used to destroy microorganisms. It destroys all pathogenic organisms except for spores. Sterilization is a process that completely destroys all microbial life, including spores. Aseptic techniques are procedures performed under sterile conditions. Asepsis is an absence of pathogenic microorganisms. Medical asepsis describes practices designed to reduce the number and transfer of pathogens. A synonym is clean technique. Surgical asepsis describes techniques used to destroy all pathogenic organisms, and is also called sterile technique. A sterile field is an area that is set up for certain procedures and is free from all organisms. Dropping items onto a sterile field like packaged items, wrapped items, and sterile draping. When pouring solutions onto a sterile field, a sterile bowl should be close to the edge, but not in the outer 1 inch. Surgical scrubbing involves a broad spectrum, surgical antimicrobial solution and vigorous rubbing that creates friction from the fingertips to the elbows. Scrubbing should continue for 3 to 5 minutes. 4 steps for self-gowning. 1. The gown is picked up by the folded edges and lifted directly up from the package. 2. The gown is grasped at the neck band, held at arm's length, unfolded, and gently shaken. 3. The gown is put on from the inside by holding it by the shoulder seams, raising the arms up, and slipping them into the sleeves. 4. An assistant fastens the back and waistband of the gown. The various steps for sterile gloving. Glove dominant hand. Grasp outside of a cuff. Touch only the inside of a glove. Do not roll the cuff. Slide fingers inside the second glove. Keep your thumb abducted, or spread. Only touch the outside surface of a glove. Skin only touches the inside of a glove. The outside of a glove can only touch the outside of a glove. Remove gloves by only touching glove to glove, and skin to skin. With an open glove technique, the scrub person's hands slide all the way through the sleeves and out beyond the cuffs. This is used for subsequent gloving and when performing procedures when a gown is not worn. With a closed glove technique, the scrubs person's hands remain inside the gown sleeves and should not touch the cuff edges. This is used for the initial donning of sterile gown and gloves. Removing sterile gloves by grasp outer surfaces with a gloved hand. Roll off first glove. Place it in the palm of your other gloved hand. Place ungloved hand under remaining glove on thumb side. Slide off the remaining glove. Cover the first glove. Discard both in a bald condition. A tracheostomy is the surgical creation of an opening into the trachea through the neck. Thoracostomy tube is a chest tube used to drain the intrapleural space and the mediastinum. It is typically inserted in the 4th or 5th intercostal space. Atelectasis describes a collapsed lung, or incomplete expansion of the alveoli. Pneumothorax, also known as a collapsed lung, occurs when air leaks into the space between the lung and the chest wall, causing the lung to collapse. This buildup of air can put pressure on the lung and prevent it from expanding properly. Hemothorax occurs when there is blood in the pleural cavity. Pleural effusion is a condition where fluid builds up in the space between the lungs and the chest wall, also known as the pleural space. This fluid accumulation can restrict lung expansion, making breathing difficult and causing other symptoms. Empyema is a condition where pus collects in the pleural space, the area between the lung and the lining of the chest cavity. It's often caused by an infection that spreads from the lung, usually from pneumonia, and can lead to a buildup of pus that puts pressure on the lungs. A urinary catheter is a tube inserted into the bladder through the urethra to drain urine from the bladder. While a C-arm itself is typically sterilized using specialized methods like high-level disinfection or even sterilization, there are 3 common methods of sterilization used in conjunction with C-arm procedures: high-level disinfection with C-arm components, covering C-arm components with sterile drapes, and using sterile instruments and supplies during the procedure. Non-aseptic technique refers to procedures that do not require sterile technique. An NG tube, or nasogastric tube, is inserted through the nose, past the pharynx and esophagus, and into the stomach. It is used for feeding and/or administering drugs, or emptying the stomach. Correct placement of NG tubes can be verified with chest X-rays. A colonoscopy is the direct visual examination of the inner surface of the entire colon from the rectum to the cecum. A virtual colonoscopy combines CT scanning and computer technology to enable physicians to examine the entire length of the colon by X-ray imaging in just minutes. A barium enema is an X-ray exam using an opaque contrast medium to examine the lower GI tract. Wilhelm Conrad Röntgen discovered X-rays on November 8, 1895. Here are 12 properties of X-rays. 1. Penetrating an invisible form of electromagnetic radiation. 2. Electrically neutral. 3. In the context of X-rays, the terms polyenergetic and heterogeneous are often used interchangeably to describe an X-ray beam that contains photons of varying energies. While both terms accurately describe this property, heterogeneous is more commonly used in scientific literature, while polyenergetic is more prevalent in some medical and technical contexts. 4. Release heat when passing through matter. 5. Travel in straight lines. 6. Travel at speed of light. 7. Can ionize matter. 8. Cause fluorescence in certain crystals. 9. Cannot be focused by lens. 10. Affect photographic film. 11. Produce chemical and biological changes in matter through ionization and excitation. 12. Produce secondary and scatter radiation. Radiation is energy that is radiated or transmitted through space in the form of rays, waves, or particles. Ionization is the process of adding or removing electrons from an atom or molecule, which gives the atom or molecule a net charge. An electromagnetic spectrum is the range of wavelengths or frequencies over which electromagnetic radiation extends. Non-ionizing radiation examples are microwaves, radio waves, infrared light, and the visible light spectrum. Examples of ionizing radiation are ultraviolet, X-rays, and gamma rays. Wave-particle duality is the concept that all matter and energy exhibit both wave-like and particle-like properties. A wavelength is the distance between two corresponding parts of a wave. Frequency is the number of complete waves that pass a given point in a certain amount of time. Amplitude is the height of a wave's crest. Low-energy photons such as radio photons behave more like waves, while higher energy photons such as X-rays behave more like particles. The American Registry of Radiologic Technologists, the ARRT, is an organization that offers national certification exams for radiographers and some sonography specialties. The ASRT is the American Society of Radiologic Technologists, and establishes practice standards for radiation radiographers. The Joint Review Committee on Education in Radiologic Technology, JRCT, promotes excellence in education and elevates the quality and safety of patient care through the accreditation of educational programs in radiography, radiation therapy, magnetic resonance, and medical dosimetry. Computed tomography, or CT, is a scanning technique using multiple ionizing X-rays to construct three-dimensional images. MRI, magnetic resonance imaging, is a technique that uses a non-ionizing magnetic field to create a computerized image of internal bodily structures. Sonography is the use of non-ionizing sound waves to produce diagnostic images and is also called an ultrasound. Echocardiography is a non-ionizing ultrasonic diagnostic procedure used to evaluate the structures and motion of the heart. Radiation therapy is the treatment of cancer with an ionizing radioactive substance, X-rays, or radiation. Nuclear medicine uses ionizing radioactive materials either to image a patient's body or to destroy diseased cells. Interventional radiology is the use of radiographic imaging to guide a procedure or confirm the placement of an inserted object. Cardiovascular radiology shows the size and contour of the heart and related structures utilizing an ionizing chest X-ray, ionizing CT scan, or non-ionizing MRI. A mammography is an ionizing radiographic examination of the breasts to detect the presence of tumors or precancerous cells. Assault is defined as an unlawful threat or attempt to do bodily injury to another. Battery is defined as the unlawful touching of another person without consent. A tort is a wrongful act or an infringement of a right, other than under contract, leading to civil legal liability. Negligence is defined as a failure to take proper care in doing something. Negligence proof examples typically involve demonstrating that someone failed to act reasonably under the circumstances, resulting in harm to another. Examples are: 1. Duty of care. The plaintiff must demonstrate that the defendant owed them a legal duty of care. 2. Breach of duty. The plaintiff must prove that the defendant failed to meet their duty of care. 3. Causation. The plaintiff must establish a causal link between the defendant's negligence and the resulting harm. This means demonstrating that the defendant's breach of duty was a direct cause of the plaintiff's injury or damage. 4. Damages. The plaintiff must prove that they suffered actual harm, such as personal injury or property damage, as a result of the defendant's negligence. This can be demonstrated through medical bills, lost wages, and pain and suffering. Fraud is defined as a deliberate deception intended to secure an unfair or unlawful gain. Residential espaloquitur means the thing speaks for itself. If the claimant is unable to prove precisely how an accident took place, they may be able to rely on the maxim residential ipsaloquitur, the thing speaks for itself. It is essential to show that the cause of accident was in control of the defendant. The accident must be of the kind that would not normally happen without negligence. Respondeat superior translates as let the master answer. An employer is vicariously liable for the behavior of an employee working within his or her scope of employment. Defamation is defined as the act of harming or ruining another's reputation, acts of slander or libel. Slander is spoken defamation. Libel is written defamation. False imprisonment lawsuits can result from restraining an individual or restricting an individual's freedom. The Patient Bill of Rights was established in 1973, and is list of rights that are designed to protect both the patient and hospital. HIPAA, the Health Insurance Portability and Accountability Act, a federal law protecting the privacy of patient-specific health care information and providing the patient with control over how this information is used and distributed. Informed consent is an ethical principle that requires that research participants be told enough to enable them to choose whether or not they wish to participate in a study. Implied consent is a type of consent in which a patient who is unable to give consent is given treatment under the legal assumption that he or she would want treatment. Patient autonomy refers to the ability and right of patients to make independent decisions about their medical care. Health informatics refers to the application of computer and information science in all basic and applied biomedical sciences to facilitate the acquisition, processing, interpretation, optimal use, and communication of health-related data. An electronic health record, or EHR, is an electronic record of health-related information on an individual that conforms to nationally recognized interoperability standards and that can be created, managed, and consulted by authorized clinicians and staff across more than one healthcare organization. An electronic medical record, or EMR, is an electronic record of health-related information about an individual that can be created, gathered, managed, and consulted by authorized clinicians and staff within a single healthcare organization. The Hospital Information System, or HIS, is a computerized management solution that handles all aspects of a hospital's operations, including financial and medical operations. A Radiology Information System, or RIS, is a system that collects, stores, and provides information on radiological tests such as ultrasound, magnetic resonance imaging, and positron emission tomography. PACS, PACS, stands for Picture Archiving and Communication System. These are computers or networks dedicated to the storage, retrieval, distribution, and presentation of diagnostic medical images. Artificial intelligence, AI, refers to a type of software that can process information on its own without human intervention, an increasingly useful asset for the medical community. The three cardinal rules of radiation safety are time, distance, and shielding. ALARA, ALARA, stands for as low as reasonably achievable. A radiology technician must strive to expose the patient to as little radiation as possible. Image Gently is a campaign initiative of the Alliance for Radiation Safety in Pediatric Imaging, in conjunction with the American Society of Radiologic Technologists as well as others to increase awareness and promote radiation protection in the imaging of children. Image Wisely is a campaign to promote lowering the amount of radiation used in medically necessary imaging procedures and in eliminating unnecessary procedures in adult medical imaging. The Sacred 7 in medical history taking refers to 7 attributes that should be explored when evaluating a symptom or complaint. These attributes are location, quality, quantity, timing, environment, influencing factors, and associated manifestations. The Introduction to Radiology textbook lists them in the following order. 1. Localization. 2. Chronology. 3. Quality. 4. Severity. 5. Onset. 6. Aggravating or alleviating factors. 7. Associated manifestations. Diversity is a noun that is defined as difference, variety, a condition of having many different types of forms. The 10-day rule in radiology is a practice to minimize potential fetal exposure to radiation during X-ray exams. Specifically, it recommends that abdominal and pelvic X-rays for women of childbearing age should ideally be scheduled within the first 10 days after the onset of their menstrual period, when the possibility of early pregnancy is less likely. This rule aims to protect the developing embryo or fetus from potential harm caused by radiation exposure. Positioning aids in radiology are devices used to support, stabilize, and ensure proper positioning of patients during imaging procedures. These aids are crucial for obtaining accurate images, minimizing patient discomfort, and reducing the need for repeat scans. Examples of positioning devices are positioning sponges, tape, sandbags, and stockinets. In radiology, stockinets are primarily used as a protective layer, typically under casts or splints, to prevent skin irritation and to help absorb moisture. An EKG, or electrocardiogram, measures the electrical potential during a heartbeat. Racism is the belief that one race is superior to another. Ethnocentrism is belief in the superiority of one's own nation or ethnic group. PQRST waves are the standard wave forms found on an EKG tracing. Each wave corresponds to a specific event in the heart's electrical cycle. P waves on an EKG signify atrial depolarization. The QRS complex signifies ventricular depolarization. The ST segment signifies ventricular contraction. The T wave represents ventricular repolarization. Bias can be defined as prejudice in favor of or against one thing, person, or group compared with another, usually in a way that a detached observer would believe to be unfair. Here are 5 patient positions. Supine, patient is lying on their back face up. Prone, patient is lying on their stomach. Lateral recumbent, Sims patient lying on their left or right side. Trendelenburg position, formerly known as the shock position, feet are elevated about 12 inches. Fowler's position. In a high Fowler's position the patient is sitting at a 90-degree angle. In a semi-Fowler's position the patient is sitting at a 45-degree angle.